everyone's doing? Well, I'm excited to be here. My name is Jennifer Selinger. I am a research assistant for McGill University, the epidemiology. I'm excited to be here. Tell you a little bit about what I do here at McGill. I'm also with the beautiful Natalia. She is the research nurse, and she will be here to answer all of the questions that I'm unable to answer. Natalia is shaking her head back and forth, and I'm wondering, what did I say?
You're supposed to say the gorgeous.
Oh, well, sorry, Natalia. So at McGill, we do groundbreaking research studies that help look at how to prevent and reduce the transmission of HPV. And for all those people out there who do not know what HPV is, it is the human papilloma virus. It is one of the leading causes for cervical cancer, penile cancer, and genital warts. There are over 130 different types of HPV, and over 75% of all Canadian women have it at least once in their lifetime. Usually the HPV types 16 and 18 are high risk and cause over 70% of cervical cancer, and HPV types 6 and 11 cause over 90% of genital warts. I mean, usually these topics of discussion aren't ones that you'd bring up at the dinner table, but we'd like to bring out statistics and share with the listeners right now what's going on behind closed doors, because I'll be honest, before I joined McGill and these groundbreaking research studies, I knew very little of HPV, so I'm happy to be here to share with our listeners what HPV is and what we do at McGill. I'm going to have the research nurse, Natalia, speak with you and give you the scoop on a few of the research studies that we are doing here.
Okay, thanks, Jen. That's a great introduction. So basically, as Jennifer mentioned, HPV, there's a lot of cases. Why is that? So people probably don't know why. It's because HPV is an infection that is transferred from skin-to-skin contact, so it's really easy to get. And that's why, as Jennifer mentioned, 75% of women who are sexually active at one point in time, they will have a HPV infection. Most infections are transient, meaning that your body just takes care of it on its own through your immune system. But there's certain ones, as she mentioned, 16 and 18 in particular, they might lead to cervical cancer. They don't always lead to cervical cancer, but they might. So it's really important to have these studies. Cervical cancer is it's silent because the only way you can detect it is if you have a Pap test. So Pap tests basically look to see if there's any irregular skin cells on your cervix. So 99.9% of all skin cells that are abnormal would be that it's a HPV infection that's starting. It doesn't always lead to cancer, as I mentioned. Sometimes your body can clear it. And unfortunately, there's other cases where people get cancer. And cervical cancer is the second most common cancer after breast cancer in Canadian women ages 20 to 44. It's quite an issue. So this is why we have 3 studies that are going on through McGill and Concordia right now. There's one that's called CATCH, and what's interesting about this one is that we're asking participants to use a gel, a lubricant during sex, and in that gel there is a derivative of algae, and it's called carrageenan.
How cool is this that they found out, well, this is what the study's all about, but basically what they're doing is they're taking carrageenan, which is a type of a seaweed, they're putting it in lube, and they're doing like this placebo test right now where some bottles have the carrageenan in it and then other bottles don't have the carrageenan in it. And right now they're trying to find out, does this seaweed actually prevent the transmission of HPV?
Because it was found in research, just basically in labs, that it was really effective at killing HPV on contact. So it's really interesting. It's the only type of research that's been going on in the world is here at McGill, this particular research. And it's really not that time-consuming when we ask participants. They come in, I think, 7 times in a whole year, and we just ask them to use the lubricant during sex, and that's basically it. And they're paid for their time. So that's really interesting one. Another one's called TRAP, and that is a study that we're doing with couples, however. So these couples, they're giving vaccines. They're giving the Gardasil 9, which prevents you against 9 of the most common types of HPV out there. Or they're given a Havrix, which is it's a hepatitis A vaccine, because it has to be like a true blind study where they don't know what they're getting. And so in that study, we're looking to see if it actually reduces transmission of genital, anal, and oral HPV infections in partners. And so now we have a new study, which is really cool because it's the first time we're actually working with the homosexual population. And it's called LIMIT. And this is actually the same kind of thing as CATCH, but with homosexual men.
The algae compound is called what again?
It's called carrageenan. So actually, if you look at your ice cream containers or your yogurt containers, you'd actually find it listed in there. It's used as a thickening agent.
Okay.
Yeah.
How did they find out that carrageenan...
I just know that they found it by chance in a laboratory setting. I don't know how exactly, but they found it by chance that it was very effective at preventing HPV and killing the HPV virus on contact. So it's quite interesting. Apparently, you just need a little drop of it, and it kills HPV quite well.
And also, an important thing that we're just going to throw out there is that if you phone to join in these research studies, which the number is, and I'm just going to throw it out there, 514-398-8191, there is a compensation. We do pay the participants who join in on this research, so it's kind of killing two birds with one stone, where we're, not only doing groundbreaking research, but we're also paying the participants. And not only do we have an office at McGill, we take participants at Concordia University as well. And we're not just aiming for students. So you can give us a phone call at 514-398-8191. We are looking for people of the ages of 18 to 40. And also you can take a look and check us up on our website, which is mcgill.ca/cancer EPI.
And so, Nat, what do you do as a nurse as part of this lab?
I follow the patient. So I first of all get her consent form or his. I explain the research to them so they're very clear about what they have to do, what samples I take. When they come in, it's quite relaxed. I'm pretty flexible with my time, so whenever they can come in is basically I'm always available pretty much. They come in, they do a consent form. They have to be anonymous. So they do a survey just about their sexual history. Then I take their samples. Actually, the female will take her own sample with a cotton swab. It's really quite easy. And there's samples that I take are mouth swabs with a toothbrush. For the men, I do the penile sample, but nothing goes inside the ureter. It's just the skin cells. As I mentioned, HPV is on the skin, so we just rub the skin on the outside of the penis. And they do their own collections of the anal sample, which is they take a Q-tip and they rub it on the outside of their anal cavity as well. It doesn't take very long. It's quite relaxed, and we pay them right away, cash, so there's no hassle. And it's just, I guess it helps out for both parties. We're able to have research that's quite interesting, and it helps the students a little bit monetarily as well.
And so this test is for the HPV virus in skin cells?
Yeah, so we're able to determine, they have these really efficient tests that are able to determine to see if there's any HPV at all on the skin cells. And most of the time there is. There are infections because, like I said, most of the infections are transient. So with time, your body, your immune system just gets rid of it. But we've had participants in the past where we found that they did have a long infection with an oncogenic type. So we actually let them know, and then at the end of the study, we actually give them a pap test, the females anyhow, and they're able to see if they have any precancer cells on the cervix as well.
How long is the follow-up period?
It's a year long. We ask them to come into the office 7 times in the year. Okay. For the TRAP study, it's it's 6 times in a year. So with the CATCH study, they come in a little bit more frequently the first month, and then after that, it's every 3 months.
Oh, okay.
And every time that you come in, you get compensated for your visit.
Yeah. And we're really fun. Okay, maybe don't sound as fun as Jennifer.
Oh, please. You're a lot of fun.
We're a lot of fun. We're laid back. So Rafaela is the other nurse that I work with, so she's great as well. Everyone's at ease with us.
What is the goal for these studies?
So we're looking at basically to see how HPV infections can be prevented and also to reduce the transmission of HPV between sexually active people.
And why is this important? I know you mentioned cancer, but...
The reason why it's important is because most people don't realize that they have a HPV infection, as I mentioned, and there's no signs or symptoms. There are signs of HPV in the sense of you can see the warts. Some forms of HPV cause warts, but those are not cancer-causing. The warts in itself, they're annoying to have, and you have to get them removed because they're very contagious. The HPV I'm more concerned about, and what people are more concerned about, are the cancer-causing ones. And those cancer-causing ones, there's absolutely no signs or symptoms until, you already have cancer or you have your Pap test every 3 years. So then you can detect to see if you have any precancer cells. So the TRAP study is a study that we're looking to see how efficient HPV vaccines are in reducing transmission of HPV between sexually active partners. So in this study, we have 2 vaccines. It's a blind study, so the participants don't know which one they're getting. They're either getting the Gardasil 9, which is a vaccine that vaccinates you against 9 of the most common HPVs out there in population. And they're also getting the Havrix vaccine, which is a hepatitis A vaccine. At the end of the study, what's interesting is that they get the other vaccine they didn't get. And just to mention, these vaccines are quite costly, but they're free. Just to mention, the Gardasil 9 costs about $155 for 1 dose, and you need 3 doses to be fully, immunized. So the criteria for this particular TRAP study, you have to be a heterosexual couple, and you'd have to be in a recent sexual relationship, which started less than 6 months ago, to be eligible for the study.
And why is that eligibility condition there?
Because HPV is an infection that is transferred very early on in a relationship, a sexually active couple's relationship. So if they're together for 3 or 4 or 5 years, by that time they've already had transmission.
Okay.
So we're looking to see right early on in a relationship.
Cool. And what about the CATCH study?
The CATCH study, you don't have to be in a particular, long-term sexual partnership, is what I'm trying to say. You just have to be sexually active.
Okay.
Yeah.
And over 18, and is it for people with cervixes only, or?
Yes, for the CATCH study, it's only females.
Okay.
So that's it. So we're asking just for females. And the limit one is for male homosexual couples.
Okay.
So it's the same study in the sense that they're both given the lubricant for free to use for a year.
Okay.
But one is a heterosexual couple, the other is a homosexual couple.
Are there any adverse health effects or risks associated with HPV other than cervical cancer?
Yes, there are.
Okay.
There are. There's certain HPVs. It's been found in literature that there's anal, oral, throat cancers.
Okay.
Yeah.
They've actually even found traces. I had no idea about this earlier, but on the hand.
In safer sex workshops that I've taught, according to the Health Canada guidelines, it is transmissible from genital to hand to genital contact, for example.
Because it's skin-to-skin contact. It's a skin-to-skin contact infection, so it's very easy to get.
It'd be interesting if after these research studies, when we find out more information about carrageenan and how it prevents HPV, it'd be interesting to see what if they started coming out with toothpaste with carrageenan and creams for the hand. Viv, thank you so much for having us. Really, it's been a pleasure. It's been fun in here. I mean, we're down to come whenever you'd like us to be here. Thank you so much for having us.
It's great to spread the word, and thank you for having us.
So once again, that's 514-398 8191. Once again, that's 514-398-8191. So hope to hear from you guys soon. This was Nat, Jennifer, and Viv on Health on Earth. Thank you so much for listening, guys.